Welcome back to In Session, a deep dive in healthcare policy we're bringing to you every week. I'm Ryan Bernal with the South Carolina Hospital Association, and here's the rundown for week 7 of the legislative year. It's hard to believe we only have 33 days left in the legislative calendar. That sense of urgency is really reflected in activity we've seen in both the House and Senate in the last couple of weeks. And in 2 weeks, the House will be on the floor debating their state appropriations bill, the budget for the state, and all of their focus will turn to dollars, followed by a weekend recess. That means the calendar and the time is even more limited for that body to get to some activity on some of our priorities. But that doesn't mean they aren't addressing some of them. Just this week, we saw activity on the HALO Act in the House Judiciary Committee. A subcommittee met Tuesday morning, followed by a full committee Tuesday afternoon, and they passed that bill out favorably. SCHA's Austin Smallwood was there to testify on behalf of healthcare workers and hospitals.
Healthcare workers are more likely to be harmed than most other industries by 5 times nationally. In South Carolina, over 7 healthcare workers are assaulted on a daily basis. This bill would be a great first step. It's not the perfect elixir to ending that problem. We understand that there is no bill that will completely solve that problem, but this is a great first step in order to help our healthcare workers have a little bit more safety in their place of work.
The HALO Act would provide a barrier, a ring after a verbal warning, a halo, if you will, to ensure that that individual is allowed to do their life-saving work. It would add those protections to protections that have already been contemplated for law enforcement, first responders, EMS, and we're grateful for the opportunity to provide that testimony, share our 2024 data collaborative report, in which our hospitals are voluntarily reporting that data. On the Senate side, the Senate Medical Affairs Committee took up S-299, an alternative transportation bill really aimed at addressing some of the liability concerns for transporting behavioral health patients and other individuals that need transport between facilities. This is to really alleviate pressures on law enforcement, who for a long time have providing that transport service, make it a little more friendly and patient-centered approach for the individuals needing that transport. But we're also seeking clarity around the questions about liability as it relates to who can transport those individuals. Since its inception, that program has grown regularly year after year. And just in the last year, an increase in volume of over 30% of utilization in that program. I think in 2025, it's about 4,000, a little over 4,000 alternative transports. So we're really encouraged by the utilization of that by our hospitals in the communities, and further encouraged by the Senate taking action on this liability issue. For our hospital of the week, this week we had Lexington Health on the grounds on Tuesday. Their new CEO, Kurt Jenkins, along with their Chief Medical Officer, Dr. Brent Powers, who serves on the SCHA board and as chair of the South Carolina Physicians Alliance board, along with other members of their leadership team, were engaging with their legislative delegation, members of leadership in both the House and Senate, and had an opportunity to be introduced in the gallery of both the House and Senate. It's so important that we are present, that our hospitals are present, reminding the legislators of our priorities, engaging in the legislative process, showing the legislators that we care about what they're doing. And we're so grateful for that turnout by Lexington Health and participation of our previous hospitals. Next week, we'll have three different hospital systems at the State House. On Tuesday, Self-Regional, Wednesday, HCA, and on Thursday, Bon Secours. And could not be more grateful for that uptick in engagement to have 3 different hospitals there present here in Columbia. Talking to members of both the House and Senate is of huge impact, and thank you to those folks. Next week on our calendar, we're hoping to see some activity on medical malpractice in the House Judiciary Committee, continue to have conversations with leadership on those efforts there, and just got notice that we're looking at a subcommittee hearing next Thursday on our hallway beds issue. So grateful again for all of the engagement by you watching this, working on behalf of hospitals, all the effort on behalf of our legislators to support hospitals. And that's all we have for week 7. See you next week.